Good afternoon, everybody, and welcome to the ABCs of Meaningful Use. My name is Michelle Boucher, and I'm the Director of Marketing here at Software Unlimited. And today in this brief session, I am going to do my best to stay on time and to the point. So any questions that you might have or that might come up, go ahead and jot them down and email them to us at the end of the session, and that information will be posted at the end. And we will answer all your questions, either via email or telephone. Also, I do want to let you know that this session is being recorded, and the link to the recording, along with a very brief survey, is going to be emailed to you after the session. So with that, let's get started. Okay, so today we're going to cover, in this session, the ABCs of Meaningful Use. What is it? How do I qualify? And the most important part, how and when do I get paid? Let's start with just a little background about the program. Back in 2009, President Obama signed the American Recovery and Reinvestment Act, or ARRA, as you may have heard it called, and it allocated over $19 billion to encourage adoption of EHRs, or EMRs. We're going to use the terms interchangeably, electronic health record or electronic medical record. The reason the government wants you to move to electronic records is because they've proven to improve quality and lower costs overall. So not only does the government want you to do this, they're going to pay you to do it. But does the government, what do they want you to do in order to get paid? Well, they want you to show meaningful use of an EMR. And that's what we're going to answer. What is meaningful use? Well, as you can see by this example of the pumpkins and pumpkin pie, meaningful use is taking an EMR and using it in a way that the government has outlined as meaningful. And the definitions of what these meaningful terms are is outlined in 5 different stages. Currently, we are in stage 1. That is to justify and identify and purchase an EMR, and to capture information for 90 days, 90 consecutive days. The draft of Stage 2 criteria has just been published this month, and the definitions of Stages 3 and beyond are still being finalized. So through the end of 2012, we are working on Stage 1. Okay, there are 2 programs, Medicare and Medicaid, that participate in this reimbursement program. You can enroll in either, or you can enroll in both, but you can't do it at the same time. And as you can see, Medicare's program ends in 2014, while Medicaid's continues on out through 2016. So you can start one and then switch to the other, or if you only accept one or the other, you can do whichever you would like first. The maximum you can receive for Medicare is $44,000, and the maximum you can receive from Medicaid is $63,000 over the 5-year period. And there are clients that we have right now that have already received money. Okay, to qualify for Medicare, you need to be an MD or a DO or anything on the list on the left. For Medicaid, you need to be any of the items in the list to the right. So if you fall in any of those categories, you are eligible to participate. If you're going to submit for Medicaid, at least 30% of your services must be furnished to Medicaid patients in an outpatient setting. If you're going to submit for Medicare, then you have to bill for Part B services on the Medicare physician fee schedule. Let me clarify a little bit further. Specifically, here's how it breaks down. You need to be a non-hospital-based provider who sees at least 30% of Medicaid-insured patients, or if you're a pediatrician, you only need to see 20% of Medicaid-insured patients. And for those providers who practice in SQHC, you have to see at least 30% of needy patients. And if you meet this criteria, you're eligible to receive the full reimbursement amount of $63,750 as long as you meet the timelines, which I'm going to give you at the end of this presentation. There's very specific timelines for this. Okay. This is one area that many people get confused about. So for Medicare, there are no patient minimums. You simply need to treat Medicare patients and bill for Part B, as I explained. And you can claim 75% of your Medicare allowed charges not to exceed $44,000 per provider. So what do I mean by allowed? I'm just going to make it very easy to understand. If you look at the COB, you can see the claim amount, the allowed amount, and the payment amount. CMS uses the alloweds, and we're going to talk about CMS in a moment, not the payments. I would recommend what you do is take a look at your entire year's alloweds for last year, and then figure 75% of what that would be to get a picture, a realistic idea of what you can expect to receive. So think of it this way. To collect the full incentive amount of $18,000 for stage 1 by the end of 2012, if you complete all of these requirements, you're going to need to submit allowable charges of at least $24,000. Okay, so now that you know what it is, how do you know if you're going to qualify? Everything you need to know is on this website, your new best friend, cms.gov. And I'm going to give you a brief tour of their 3 things that you have to do first on this website, and I'm going to show you exactly what those look like. You can do these 3 things anytime once you've implemented your EMR. The first thing you're going to do is get your EMR's certification number. The second thing is to register yourself. And then the third thing is that you are going to register your EMR. Let's take a look at how that works. So first you need to look up your program's certification number. And you can do that by entering the vendor name or the product name. If your EMR doesn't come up, if it is not certified, you will not be able to participate in this program at all. Next, you're going to go ahead and add it to your cart. You're not going to be charged for this. It's just a step in the process. And once you do that, CMS will give you the certification ID number. And you're going to want to print this page out or make a note of this number so that you have it handy, because you're going to use it in a moment. Next, you're going to register yourself. So go back to this specific website, cms.gov/EHR incentive programs. And you're going to go ahead and create a login and password and give yourself a bunch of secret questions and answers that hopefully you'll remember. Then you're going to log into the system. Now, you can do this anytime, as I said, during or before or even after your 90 days of use. It does not matter. And we're going to talk about the 90 days in a moment. Now you're going to go ahead and register your EMR. So click on the registration tab. You're going to click on register. And then you're going to select the program type that you're registering for, whether it's Medicare or Medicaid. You're going to select the type of eligible provider that you are from the pick list. And then you're going to click yes, that you do have a certified EHR, and enter that number that I told you you needed to make a note of. Then you're going to select the type of entity that is going to receive the money and verify that everything is accurate and complete, and you'll get a confirmation page. So now that you know you're eligible, how much you'll receive, and you've registered your EMR in yourself, it's time to go ahead and start using that EMR in a meaningful way. Okay, let's talk about what that means. Number one, you're going to need to use your EMR for 90 days, 90 consecutive business days within 2012. During that 90-day period, you're going to need to collect data on 20 criteria, and there are 15 specific required core criteria, and then 5 more that you can choose from. After you've done that, after you've met your criteria, you're going to go back online to cms.gov, and you're going to do what's called attestation. You're going to let them know that you've completed everything. Okay, look, this is what the criteria actually is. These 15 measures are all required. For example, vitals, blood pressure and BMI, you need to be recording 50% of the vitals of the patients that you see. You need to record 50% of the smoking statuses of the patients that you see during this 90-day period. For e-prescribing, it's 40%. And for each of these, it tells you how much you need to record during your 90-day reporting period. Here are the menu criteria. So you're going to do all 15 of the prior, and then you're going to pick any 5 of these to report on as well. In some EMRs, like ours, the one that we sell, Prognosis, there is a meaningful use criteria dashboard that will automatically track your progress for meeting these measures. So ours works in 2 ways for the core measures, on the patient level and on the practice level. On the patient level, before you close out an encounter, it's going to give you a green thumbs up or a red thumbs down on the items that you have either completed or not completed for that encounter. You can take a look at the thumbs in the lower right-hand corner. On the practice level, the gauges that you see are going to show you how close you are to satisfying each of the core criteria based on the percentage of information that needs to be entered during your 90-day reporting period. So if you take a look at vital signs, you can see that currently the needle is at 0, so you haven't recorded, this physician has not recorded any vital signs yet. And the requirement is where the blue bar is, it's at 50%. So as you enter data, that needle's going to move closer towards that blue bar, and when you get to that blue bar or beyond it, you're going to know that you have met that requirement. Once you have met the requirements, or actually at any time during your 90-day reporting period, you can use this meaningful use report to help you attest. Now, this report can be run at any time, but what it's going to do is show you exactly where you are in all the criteria. Notice the numerator and the denominator. You're going to need to have both of these numbers handy when you attest, and I'm going to show you that in a moment and explain what those numbers are. But this report makes it very easy for you to simply glance at the information during your attestation period and know that you have met the proper amount of percentages for the criteria. Here's another thing that you can do to be sure you're going to pass the attestation. The CMS.gov has this attestation calculator that will run you through a series of questions that tells you whether or not you're ready to attest. You know, even though you think your numbers show that you are, it's a good idea to run through this calculator, because if you start your attestation and find that you are off on one of your calculations for any reason and you do not pass attestation, you've got to record all over again, starting with a new 90-day period before you can re-attest and pass. Okay, and that's important because when you attest, once you attest, that's what it takes in order to get paid. So when you are ready to attest, you're going to go back to cms.gov. You're going to click the attestation tab or link. You'll go through and answer all the objectives. This is an actual attestation objective question. It's going to take you about, I would allow 2 hours for this. You're going to want to go through this pretty thoroughly and make sure that all your answers are correct. These attestations are also going to be randomly audited. So if you think you can kind of just go through and answer yes to everything, well, you may be able to, you know, kind of fake your way through it. But if you're audited, you have to have that proof, which is in that 90-day attestation period, and that report that I showed you, that's your proof that you have met all of these requirements. So here's an example of a yes or no type of a question, and here's an example of a percentage answer type of question. Remember the numerator and the denominator that we talked about? You'll see that comes into play right here. The denominator is the actual number of patients you saw during the 90-day period, and the numerator is the number of patients you collected data on to meet this requirement. This is how you use your report. You're going to have this sitting right next to you, and you're just going to copy your percentages down line by line from each of your 15 criteria and the 20 and the other 5 that you've selected. Okay, now that you have used the EMR in a meaningful way during the 90-day period and have successfully attested to CMS, you should receive your check within 15 to 45 days. And it will look something like this if you actually elect to have a physical check sent to you. This is an $18,000 check that was sent to one of our clients. And you can also have it just direct deposited into your account if that's what you prefer. Okay, important dates to remember. Take a look at this timeline. In order for you to collect the full amount available from either Medicare or Medicaid for 2012 for stage 1, this is the time frame you need to be thinking about. In June of this year, you'll want to sign a contract for an EMR. In July, you're going to want to start implementation, customization, training, etc. And you're going to maybe want to start using it through July, August, September, beginning your 90 days of contiguous use. October 1st is the very last day to start your 90 days of use for 2012. And if you end up starting after October 1st, you will not be able to collect the entire available amount for stage 1 for 2012. Okay, that concludes our session today. Quick and easy, right? So I'm sure you have questions, and we're very happy to answer them individually. We can either give you a call, or you can certainly email them to either myself or to our good friend Yishai Goodman, who is our National Director of Sales. And yeah, he likes to think he looks like Brad Pitt, but well, I'm not so sure Brad would agree. Also, there is a lot of information on our blog, and the address is on your screen. You can also visit us on our website at suimd.com. And this does conclude the ABCs of Meaningful Use. Again, you're going to receive a brief survey and a link to the recording of this session, and you'll be able to download the presentation as well. I want to thank everybody for attending today, and I hope that you have a wonderful day. Thank you very much. Bye-bye.